51. Diabetic retinopathy can lead to blindness if untreated. True or false? Answer: true. Rationale: diabetic retinopathy damages retinal blood vessels, potentially causing blindness if untreated, emphasizing the need for tight glucose control and ophthalmologic monitoring. 52. Hypothyroidism is caused by excessive thyroid hormone production. True or false? Answer: false. Rationale: hypothyroidism results from deficient thyroid hormone production, leading to symptoms like fatigue, requiring levothyroxine to restore metabolic balance. 53. Administering insulin is appropriate for a patient with diabetic ketoacidosis. True or false? Answer: true. Rationale: intravenous insulin reduces blood glucose and ketone production in diabetic ketoacidosis, a critical intervention to correct acidosis and ensure patient stability. 54. Pheochromocytoma is a pituitary gland tumor. True or false? Answer: false. Rationale: pheochromocytoma is an adrenal medulla tumor causing catecholamine excess, not a pituitary tumor, requiring distinct diagnostic and surgical management. 55. Hyperparathyroidism can cause kidney stones. True or false? Answer: true. Rationale: hyperparathyroidism increases calcium levels, promoting kidney stone formation, requiring monitoring and possible surgical intervention to prevent renal complications. 56. Type 1 diabetes can be managed with oral hypoglycemic agents alone. True or false? Answer: false. Rationale: type 1 diabetes requires insulin therapy due to absolute insulin deficiency, unlike type 2, which may use oral agents, ensuring effective glycemic control. 57. Graves' disease is a common cause of hyperthyroidism. True or false? Answer: true. Rationale: Graves' disease, an autoimmune condition, causes hyperthyroidism by stimulating thyroid hormone production, requiring antithyroid drugs or surgery for management. 58. Hypoglycemia unawareness is more common in type 2 diabetes than type 1. True or false? Answer: false. Rationale: hypoglycemia unawareness is more common in type 1 diabetes due to frequent glucose fluctuations, requiring careful monitoring to prevent severe episodes. 59. The ACTH stimulation test is used to diagnose Cushing's syndrome. True or false? Answer: false. Rationale: the ACTH stimulation test diagnoses adrenal insufficiency, while Cushing's syndrome is confirmed with tests like the dexamethasone suppression test for cortisol excess. 60. Diabetes insipidus can cause hypernatremia. True or false? Answer: true. Rationale: diabetes insipidus leads to excessive water loss, increasing serum sodium and causing hypernatremia, requiring desmopressin and hydration to restore balance. 61. Levothyroxine can cause weight loss in hypothyroid patients. True or false? Answer: true. Rationale: levothyroxine restores metabolism in hypothyroidism, often leading to weight loss as a therapeutic effect, requiring monitoring to ensure optimal dosing. 62. Diabetic ketoacidosis is more common in type 2 diabetes than type 1. True or false? Answer: false. Rationale: diabetic ketoacidosis is more common in type 1 diabetes due to absolute insulin deficiency, requiring urgent insulin and fluid therapy to correct acidosis. 63. Acromegaly can cause diabetes mellitus as a complication. True or false? Answer: true. Rationale: excess growth hormone in acromegaly impairs insulin sensitivity, causing diabetes mellitus, requiring glucose monitoring and pituitary treatment for management. 64. Patients with Addison's disease are at risk for hypoglycemia. True or false? Answer: true. Rationale: cortisol deficiency in Addison's disease impairs gluconeogenesis, increasing hypoglycemia risk, requiring glucocorticoid replacement and glucose monitoring. 65. Thyroid storm can be triggered by stress or infection. True or false? Answer: true. Rationale: Thyroid storm, a hyperthyroidism crisis, can be triggered by stress or infection, causing severe symptoms requiring urgent antithyroid drugs and supportive care. 66. Insulin should be administered intravenously for routine diabetes management. True or false? Answer: false. Rationale: insulin is typically administered subcutaneously for routine diabetes management, with intravenous use reserved for emergencies like diabetic ketoacidosis. 67. Hypoparathyroidism can cause hypercalcemia. True or false? Answer: false. Rationale: hypoparathyroidism reduces parathyroid hormone, causing hypocalcemia, not hypercalcemia, requiring calcium and vitamin D to prevent neurological complications. 68. A patient with hyperthyroidism may experience insomnia. True or false? Answer: true. Rationale: hyperthyroidism increases metabolism, causing symptoms like insomnia due to nervous system overstimulation, requiring antithyroid therapy to restore balance. 69. Prolactinomas always require surgical intervention. True or false? Answer: false. Rationale: prolactinomas are often managed with dopamine agonists like cabergoline, with surgery reserved for non-responsive cases, ensuring effective pituitary control. 70. Diabetic neuropathy can be completely reversed with glucose control. True or false? Answer: false. Rationale: diabetic neuropathy is not fully reversible, but tight glucose control can slow progression and reduce symptoms, emphasizing preventive foot care for safety. 71. Desmopressin is used to treat type 1 diabetes. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus by mimicking antidiuretic hormone, while type 1 diabetes requires insulin to manage glucose levels effectively. 72. Hyperaldosteronism can cause muscle weakness. True or false? Answer: true. Rationale: hyperaldosteronism causes hypokalemia, leading to muscle weakness, requiring potassium supplementation and aldosterone antagonists to ensure patient stability. 73. Hypothyroidism can cause goiter formation. True or false? Answer: true. Rationale: hypothyroidism, particularly from iodine deficiency, can cause goiter as the thyroid enlarges to compensate, requiring thyroid hormone replacement for management. 74. Administering glucagon to a patient with hyperglycemia is appropriate. True or false? Answer: false. Rationale: glucagon is used for hypoglycemia to raise blood glucose, not hyperglycemia, which requires insulin to lower glucose and prevent metabolic complications. 75. Cushing's syndrome can cause hypertension. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome increases blood pressure through sodium retention, requiring monitoring and treatment to prevent cardiovascular complications. 76. Diabetes insipidus is caused by insulin deficiency. True or false? Answer: false. Rationale: diabetes insipidus results from antidiuretic hormone deficiency or resistance, not insulin deficiency, requiring desmopressin to manage fluid balance. 77. Methimazole is used to treat hypothyroidism. True or false? Answer: false. Rationale: methimazole treats hyperthyroidism by inhibiting thyroid hormone synthesis, while hypothyroidism requires levothyroxine to replace deficient hormone. 78. Diabetic ketoacidosis can cause dehydration. True or false? Answer: true. Rationale: diabetic ketoacidosis causes osmotic diuresis from hyperglycemia, leading to dehydration, requiring intravenous fluids to restore volume and ensure stability. 79. Acromegaly can cause joint pain. True or false? Answer: true. Rationale: excess growth hormone in acromegaly causes joint overgrowth, leading to pain, requiring pituitary treatment and symptom management to improve quality of life. 80. Patients with type 1 diabetes are at risk for hyperosmolar, hyperglycemic state. True or false? Answer: false. Rationale: Hyperosmolar hyperglycemic state is more common in type 2 diabetes, while type 1 diabetes is associated with diabetic ketoacidosis due to insulin deficiency. 81. Hypothyroidism can cause depression. True or false? Answer: true. Rationale: hypothyroidism slows metabolism, affecting neurotransmitter function and causing depression, requiring thyroid hormone replacement to improve mental health. 82. Administering hydrocortisone can cause hyperglycemia. True or false? Answer: true. Rationale: hydrocortisone, a glucocorticoid, increases blood glucose by promoting gluconeogenesis, requiring monitoring in patients with diabetes or adrenal disorders. 83. Hyperparathyroidism can cause fatigue. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to fatigue and weakness, requiring calcium management and possible parathyroid surgery for symptom relief. 84. Insulin pens should be refrigerated after opening. True or false? Answer: false. Rationale: insulin pens can be stored at room temperature after opening for up to a month, ensuring convenience while maintaining efficacy for glycemic control. 85. Thyroid storm can cause fever. True or false? Answer: true. Rationale: thyroid storm, a hyperthyroidism crisis, causes fever due to excessive metabolic activity, requiring urgent cooling measures and antithyroid drugs for stabilization. 86. Addison's disease can cause hyperpigmentation. True or false? Answer: true. Rationale: Addison's disease increases ACTH due to cortisol deficiency, stimulating melanocytes and causing hyperpigmentation, a key diagnostic clue requiring hormone replacement. 87. Type 2 diabetes is always associated with obesity. True or false? Answer: false. Rationale: while obesity is a risk factor, type 2 diabetes can occur in non-obese individuals due to genetic or other factors, requiring individualized management plans. 88. Hypoglycemia can cause diaphoresis. True or false? Answer: true. Rationale: hypoglycemia triggers sympathetic activation, causing diaphoresis, a warning sign requiring rapid glucose administration to prevent neurological harm. 89. Prolactinomas can cause infertility in women. True or false? Answer: true. Rationale: excess prolactin from prolactinomas disrupts ovulation, causing infertility, requiring dopamine agonists to restore reproductive function and hormonal balance. 90. Diabetic foot ulcers are caused by poor wound healing. True or false? Answer: true. Rationale: poor wound healing in diabetes, due to neuropathy and poor circulation, causes foot ulcers, requiring meticulous wound care to prevent infection and amputation. 91. Desmopressin can cause hypertension. True or false? Answer: true. Rationale: desmopressin increases water retention, potentially raising blood pressure, requiring monitoring to ensure cardiovascular safety in diabetes insipidus treatment. 92. Hyperthyroidism can cause weight loss despite increased appetite. True or false? Answer: true. Rationale: hyperthyroidism accelerates metabolism, causing weight loss despite increased appetite, a hallmark symptom requiring antithyroid therapy to restore balance. 93. Hypoparathyroidism can cause seizures. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, lowering seizure threshold and causing seizures, requiring calcium and vitamin D to stabilize neurological function. 94. Administering insulin to a patient with a blood glucose of 200 milligrams per deciliter post-meal is always necessary. True or false? Answer: false. Rationale: a post-meal glucose of 200 milligrams per deciliter may not require immediate insulin, depending on the patient's plan, emphasizing monitoring and individualized therapy for control. 95. Cushing syndrome can cause muscle weakness. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome causes protein catabolism, leading to muscle weakness, requiring cortisol-lowering therapies to improve strength and function. 96. Diabetes insipidus can cause concentrated urine. True or false? Answer: false. Rationale: diabetes insipidus causes dilute urine due to antidiuretic hormone deficiency, requiring desmopressin to reduce water loss and prevent dehydration. 97. Levothyroxine can cause tachycardia as a side effect. True or false? Answer: true. Rationale: excessive levothyroxine can mimic hyperthyroidism, causing tachycardia, requiring dose adjustments and monitoring to ensure cardiovascular and endocrine safety. 98. Diabetic ketoacidosis can cause abdominal pain. True or false? Answer: true. Rationale: diabetic ketoacidosis causes metabolic acidosis, leading to abdominal pain, requiring insulin and fluids to correct acidosis and alleviate symptoms. 99. Acromegaly can cause hypertension. True or false? Answer: true. Rationale: excess growth hormone in acromegaly increases vascular resistance, causing hypertension, requiring pituitary treatment and blood pressure monitoring for safety. 100. Patients with type 1 diabetes can develop insulin resistance. True or false? Answer: true. Rationale: while rare, type 1 diabetes patients can develop insulin resistance, often due to obesity or stress, requiring adjusted insulin regimens to maintain glycemic control.